Well, good morning, everyone. As many of you already heard from Dr. Levine and city officials this morning, we're now considering the situation in Winooski an outbreak, with a few dozen cases over the last week. Dr. Levine will share another overview in a minute, but it's important to note that our EPI team has been on top of this situation, using our enhanced tracing and testing to keep this contained. So far, the cases are confined to one social network of families, which tells us that while there may be, and likely will be, more cases, we expect to contain it from spreading more broadly across the city or state. I know this will worry some Vermonters, but the important thing to understand is this is exactly what we've been preparing for over the last several weeks. Stay home, stay safe was not only about slowing spread and saving lives, it also allowed us to build up our testing and tracing capacity so that if we have new and better tools to deal with this virus, we can use them. And having them means we don't have to take the same extreme measures we did in March and April. And the fact is, because of these tools, we can and are boxing in this outbreak, which means what wouldn't have been possible 2 months ago is a reality today. So, in close consultation with Dr. Kelso and our EPI team, along with Dr. Levine, we feel it's still safe to move forward with limited indoor dining and less restrictive travel. As I previewed earlier this week, ACCD will issue guidance today allowing restaurants to open for limited indoor dining beginning on Monday. One of the many things that Vermont is known for is local food and craft brews, so I know how important this sector is to our economy. But it's also one where people are typically close to each other for a long period of time. So we're going to have to change things up in order to reopen with this virus still among us. And that's why, as I said on Wednesday, it won't be dining as usual with this first step. There will be a 25% capacity limit, and there must be at least 6 foot between parties. Traditional bar seating will be closed, and reservations are required. There are also other spacing and cleaning requirements which can be found at accd.vermont.gov. Again, I know we still have a very long way to go to help our restaurants get back on their feet. And I know they can't make it on 25% capacity, but we've got to start somewhere. And we'll be able to build on this if the numbers move in the right direction. I again want to assure you that Dr. Kelso, Dr. Levine, and other experts at the Department of Health are comfortable moving forward with this step. Because if they weren't, we wouldn't be doing it. And it's important to note the executive order does allow municipalities to keep restaurants closed if there is a local health reason to do so. So on that point, our EPI team is currently working with Winooski officials to keep an eye on any wider community spread and to consult with them on whether they may want to take a pause on these openings. On Wednesday, I also previewed that the Restart team, which includes the Department of Health, Public Safety, the Agency of Commerce, and Commissioner Pichek, have been working on a plan to open up some state-to-state travel without having to quarantine. Through this work, we've developed a data-driven scientific way of looking at the health risks throughout the region and set a threshold that will not only allow us to welcome more regional visitors, but also allow Vermonters to travel to these safe areas and return without a 14-day quarantine. We've amended our travel restrictions to allow people living in counties in New England and upstate New York, but have 400 or fewer active COVID cases per million people to come to Vermont without having to quarantine. This also means Vermonters could travel to these locations and return to Vermont without quarantining, though it should be noted that they'll need to follow any travel restrictions those states may have. With this step, we're also increasing lodging capacity to 50%, including campgrounds. These changes are effective this Monday, June 8th. Mr. Pichek will show today's map shortly. This will be updated weekly to advise Vermonters and our lodging establishments weekly guidance on these trusted travel areas. This first phase will still only be a small portion of our northeastern region, but it's a step in this process. And in the coming weeks, we can expect to further reduce quarantine requirements to get this important sector of our economy moving again, but in a safe way. Now, I recognize this is a lot to absorb given this Winooski outbreak and alongside ongoing national turmoil and grief. But again, I want to be clear. Each of these steps is done with the guidance of the health experts. And the fact is, outbreaks are going to continue. But that's exactly why we built up our capacity to box them in, and we can restart our economy while also keeping people safe. We'll continue to work our way through this and learn from it so that we can continue to further strengthen our response, which is exactly what we need to do to bridge the gap to a time when there's a vaccine. I want to thank the Health Department and the City of Winooski and all our partners for their ongoing work to keep members of this community safe and informed. Now, before I turn it over to Dr. Levine, I want to make one quick announcement on some news out of Washington. One of the financial resources that's been available for businesses, the Paycheck Protection Program, or PPP, is on a path to being updated and extended. A new bill has passed Congress, and the President is expected to sign it, which will extend the covered period to the end of the year, distribute funds over 24 weeks instead of just 8, and making changes to forgivable portions of the loans. ACCD will be hosting a webinar at 2 p.m. today to update businesses on these changes, and you can find it at accd.vermont.gov. With that, Dr. Levine.
Thank you, Governor Scott. We're going to talk for a brief moments about Winooski and about protests. I recognize and certainly understand the fear and uncertainty that people across the state, and particularly in Winooski, must be feeling upon hearing the news of an outbreak of COVID-19. I do want to impress upon you the fact that this could occur anywhere. Anywhere in the world, anywhere in the country, anywhere in our state. If we've learned nothing else from COVID-19, it is just that. We've also learned that we have little immunity to this new virus. It can easily be passed from person to one another. It can be very difficult for people to take all the steps necessary to prevent the spread of the disease. Vermont has indeed fared much better than other places, but as the governor just stated, an outbreak like this was not unexpected, especially as more sectors are opened up across the state. We've been saying this all along. We're so thankful and appreciative to the people of Vermont and everything they've done to help us flatten the curve and keep others safe. And this includes the many people who are affected by this outbreak. I want to take a few minutes to just tell you what we know right now and the actions we've been taking in a significant partnership and collaboration with city leaders, community partners, service organizations to bring this outbreak under control. This kind of process is exactly how public health becomes successful. Not a new secret we just learned from Winooski or from COVID-19. This is the tradition of public health. Since we first learned of the cluster of cases late last week, we've been working together to provide guidance while listening to find out what the needs of people in the community are and how we can best meet those needs. And to get a better understanding of how many people may be affected, we worked well with the city, our local health office, the community health centers of Burlington, to offer testing at the O'Brien Community Center every day this week, and it will be offered next week as well. So what we've learned so far from this focused testing effort, which has been very helpful, is that there are more and more people in the community that have indeed volunteered to be tested. To date, we've learned that 34 Winooski residents have tested positive. They're about equally divided between adults and children. And this confirms that there is ongoing spread, an outbreak. When we say something's an outbreak, it means there's a number of cases in a community that are connected to each other in one way or another. But our whole ability to identify cases and then identify close contacts depends on people being tested. It means that just like in every community, there are likely cases that we won't know about without widespread testing. So we'll continue to offer testing next week as well, as I mentioned. Having as many people tested as possible is very important, and we encourage every Winooski resident to get the test, whether or not you think you might have COVID. And as I've said many times here, people may remain totally asymptomatic during the time course that they've had the infection, or be asymptomatic in that 48-hour pre-symptomatic period before they're capable of transmitting an infection. Anyone who gets tested will learn within 1 to 2 days of getting tested that they have a positive test. They'll be contacted by a member of the health department team. They will know the result. They will understand what support is available to them, what connections to care can be provided as needed, and how to help guide them about what to do to prevent others from getting sick. To date, 436 tests have been processed. We still lack the results from 93 that were delivered to the lab late last night. I've described in detail and won't reiterate today the box-it-in strategy, but that is exactly the containment strategy that public health is using in Winooski as it's used in numerous other outbreaks across the state during these last several months. Testing, isolation, contact tracing, and quarantine. That is the successful formula. We are so thankful that every person who we've contacted so far understands this. They get it. And reports they are doing everything they can and should be to keep others from getting sick. Because in reality, the only way to get through this is to get through it together, and the only way to stop the outbreak is to do it together. We need every single person to help keep the disease from spreading. That means continuing all of the things that we've talked about in the past. Wearing facial coverings, limiting close interactions, lots of hand washing. I'd like to just move on to a small discussion about recent protests. Obviously, in Vermont, we have had protests, as has everywhere else in the country. Our size doesn't allow us to be featured on the evening news quite often across the country, and that's fine. But that doesn't mean our protests haven't been anywhere near as passionate as those everywhere else. I would say that they are predominantly peaceful, though, which may be different than many other places. I'm here to support everyone and all of the reasons why they've protested and to provide a public health message. We understand that people understood that looking at historical injustice, structural racism, economic inequality, all of the factors that went into why they wanted to protest, they were weighing against the potential risk of being in a setting where people were very close together. I just want to pivot off an announcement made by the director of the Centers for Disease Control today and asking all those who were involved in a protest to, again, be altruistic. You were protesting in support of fellow man and against all of the causes that you were out there talking about. But now be altruistic again and get yourself tested. It's important for your own health. It's important for your family's health. It may be important for another Vermonter's health that you interact with in the near future. And as you know, there are abundant ways to go about that. I invite you to go to the healthvermont.gov website, look at the testing pop-ups schedule, look where there's testing available near you, and follow through on this small request to help yourself and help all Vermonters. Thank you.
Good morning. Today marks our 10th public briefing on Vermont's COVID-19 data and modeling outlook. Like our prior briefings, I want to first provide an update on the data from this past week, and then we'll review the 4 key reopening metrics we continue to monitor very closely. I will conclude with an update on the Northeast regional data and discuss how that informed our decision to remove the 14-day quarantine from leisure travel to and from 55 counties in New York and New England. As always, for those watching at home, you can find today's presentation on our department's website at dfr.vermont.gov under our COVID-19 resource page. Certainly the most noteworthy aspect of our data this week relates to the community outbreak in Winooski. And being a Winooski resident myself, I know our city's many strengths, including our proud diversity, our strong sense of community, and our neighborly compassion, will serve us well during this difficult time, as it has throughout the pandemic. But we must remember that community outbreaks like the one in Winooski are not unexpected, as Dr. Levine said. However, they are difficult to predict, and they are not necessarily indicative of our longer-term forecast. There is some important context to keep in mind as well. 36 confirmed cases in a single day is a large number for Vermont, but our northern New England neighbors have regularly seen similar or greater daily numbers for the past 2 months. Since April 1st, Maine has averaged 33 cases every single day, while New Hampshire has averaged 69 new cases. And because our numbers have been so low for such a long time, the 36 cases reported yesterday will certainly skew our data, but due to the quick response of the entire Department of Health team and their efforts to trace, test, and isolate those exposed, we anticipate that this event will smooth out over time. You can see here we've deviated from our projections, which again is not unexpected given the large number of cases yesterday, and again, not necessarily indicative of our longer-term forecast. We anticipate continuing to follow the trajectory that we were on prior to the forecast once we have confirmed the outbreak is under control. To briefly review our state's mobility, we actually saw a sharp decline in mobility last weekend, but expect our overall mobility to continue to climb as we continue the reopening of Vermont and as the summer weather continues to warm. We've also been continuing to see the state's testing efforts increase and surpass the benchmark of 1,000 tests per day. Again, this is especially important in the context of an outbreak, and we've seen the Department of Health quickly deploy increasing testing to Winooski in that response. I want to turn to our reopening metrics that we've talked about each week for the past couple of months. And I first want to remind everyone that these are broad, statewide metrics that help us measure how to restart Vermont and how it is proceeding. And despite the community outbreak, they are all continuing to trend favorably. First, our syndromic surveillance continues to show an overall decline in Vermonters seeking care for COVID-19-like symptoms in the past 2 months. And as of today, we remain safely below our 4% guardrail. Turning to our second metric, the viral growth rate, you can see that our 3- and 7-day averages did jump with the addition of yesterday's cases. However, caution would only be raised if we saw sustained viral growth over a number of days. And again, due to the good work of the Department of Health, we do not anticipate that happening at this time. We also note that it is useful to compare our growth rate given the outbreak compared to where we were less than 2 months ago. You can see the growth rate continues to be quite low compared to mid-April and also times prior to that. Our third data point is the percentage of new COVID-19 tests that come back positive. And as you can see, we saw a similar jump in our numbers. But again, this metric continues to remain well below our 5% guardrail, despite increased testing and the community outbreak. Our fourth metric is hospital and critical care bed availability. And again, there's continued good news on this front. We do not, as of today, have a single COVID-19 related admission in our hospitals. And further, the ICU availability trended down this week and remains well below our 30% ICU buffer. Again, taken together, this continues to tell a good story and a favorable trend. Transitioning to our work on the regional level, the next slide compares again the cases that were new for the week of May 21st to May 28th, and then again for May 29th to June 4th. Again, we can see how few new cases Vermont continues to experience relative to our neighbors. We also see continued improvement week over week on the region as a whole, down 16%. New cases were down 16% across the region. Similarly, we saw the total of COVID-related deaths this week, and we saw some improvement across our region. And fortunately, we did not report any new fatalities in Vermont. The next slide shows again the updated version of our drive time map that we presented last week, and it's a good reminder of the reasons why we must remain cautious when looking at those states around us. This week we did see, however, the number of active cases in the Northeast decline, but again, that number still remains about 160,000 within a 5-hour drive of Vermont. But if you do take a closer look at the drive time map and look at where the active cases are prominently located across our region, it does tell a little bit different of a story. We have spent the last few weeks analyzing our regional data with the intent of making an informed, data-driven determination about when leisure and non-essential business travel can start to safely resume in our region without a quarantine. This was certainly a difficult task given the proximity to the states around us that continue to have a high case count. We also did not necessarily feel comfortable making this determination on a state-by-state basis due to the fact that each of our neighboring states continues to have areas of concern related to COVID-19. However, when looking past our state borders, we can see that there are many places across the Northeast with a low active case count and which travel to and from would present low risk of infection. Accordingly, our department, in close consultation with the Department of Health, determined that counties across the Northeast with an active case count below 400 active cases per million were safe to eliminate our 14-day quarantine. The resulting map helps illustrate the counties across our region where the risk of COVID-19 transmission remains low and where we can safely reopen travel to and from without a quarantine. Again, this is approximately 55 counties across New York and New England, representing approximately 11% of the region's population, or about 3.6 million people. ACCD will provide further guidance about this first step in the reopening process this afternoon, but as the governor highlighted, the process will be, or the policy will be effective on June 8th. And again, travelers to and from a Step 1 county will not be subject to a 14-day quarantine. The travelers must arrive via their personal auto without stopping, and travelers are required to sign up for daily symptom check reminders with Sarah Alert with the Department of Health. And again, of course, travelers are reminded to safely connect with friends and family while they're in Vermont. ACCD will provide further guidance about further steps in this reopening process, including a quarantine program that hopefully, depending on how our data proceeds, will be rolled out by the middle of June, which will allow travel from not only the Step 1 counties, but from those counties that do have a high percentage of disease as well. In closing, despite the recent community outbreak, Vermont's reopening metrics continue to tell a favorable story and inform us that we are well positioned to reopen safely and gradually. We acknowledge this first step that we've made in leisure travel is small, but it is a safe and measured approach. We will continue to study and track the trajectory of COVID-19 across the Northeast and make decisions about the safety of Vermonters based on the evidence. We certainly look forward to the day when we can welcome everyone to Vermont without a quarantine requirement, because that hospitality and that openness is really the true spirit of our state. At this time, I'd like to turn it back over to the governor.
With that, we'll take questions.
All right, as we let all the reporters on the line know, we do have a hard stop at 12:45, so we're asking for one question. If you need to clarify that answer, you can, but otherwise, we'll loop back to you if you have a follow-up or a different question. Calvin?
Thank you. So, seeing as how the vast majority of our tourism revenue and visitors come from like metropolitan New York area, Massachusetts, Connecticut, as of right now, do you think this newest influx of travelers will be enough to sustain our travel and tourism economy? And also, are people allowed to come in from out of state from places that have low caseloads, like Wyoming or Nebraska as well?
Yeah, at this point in time, it's a great question. At this point in time, we're really focusing on the Northeast, New York and New England area, because that's the number of people coming to travel into Vermont. That's where they come from. As well, we can't forget about Canada. That border is closed until at least the 21st. We'll be opening up at some point, but we'll be concerned again about the Montreal area and as well. So we'll include that at some point. But it's a first step. We hope that again, as we see the numbers being reduced in those states, New York has seen tremendous decline over the last couple of weeks. Massachusetts is seeing a lot of good news out of Massachusetts. And again, New Hampshire, upstate New Hampshire, the majority of Maine, all safe to come to Vermont. So we just thought it was a good first step. We'll continue to monitor, and as they open up and become to that threshold of 400 cases, active cases per million, then we'll be able to let them come in as well without quarantining. Now, it doesn't mean they can't come at this point, but they have to quarantine beforehand.
Stuart?
In terms of protests, we're about a week removed from a large protest in Burlington that's all over 1,000 people, and there are more expected this weekend here in Montpelier, a smaller one maybe for Jens. About a week removed from Burlington, is the state aware of anybody that has tested positive after attending that Burlington event? And kind of what are you expecting, if anything, this weekend in terms of any expected virus exposure?
Again, I don't believe, I'm going to ask Dr. Levine to answer, but I don't believe that we've traced any cases back to that protest, but it's still a little bit early at this point. And none of the tracing of the cases in Winooski led us back to that either. So, Dr. Levine?
Just that is accurate. Aside from what's happened with Winooski, we've had such a low number of positive cases every day that they didn't indicate any widespread spread of virus due to these protests. Keep in mind, of course, to become symptomatic, average 4 or 5 days. By day 7, the majority, so we have to watch out for that. But the other part of that is one of the questions we are asking those who have a positive test is not did you attend a protest, but have you been involved in any mass gatherings? Because obviously that's an opportunity for that person to have spread virus to others. So I suspect if there was an uptick in people answering that question affirmatively, we would begin to consider that a protest was related, but nothing to this point.
Steve?
I follow up on that, Doctor. Is the department actually setting up to track that?
Yeah, so we are tracking participation in mass gatherings. Absolutely.
Going to the phone lines, Greg, the county courier. Greg, the county courier.
Hi, Governor. Sorry. Hi, Governor. I wanted to follow up on my question on Wednesday first, which was mostly answered and partially just answered just now by the last questioner. If you guys, if your staff is going to be finding out about contact with large gatherings, at what point will the public know if somebody in a large gathering tested positive?
Again, I'm not sure that I completely understand the question. You mean when they test positive, they'll be listed as testing positive?
So if somebody tests positive and contact tracing determines that they have participated in a mass gathering, at what point does the health department let the public
Okay.
know?
Got it. Yeah.
At the Burlington protest or at the such and such church service, there was somebody that tested positive.
Understand. Dr. Levine.
Yeah, so that's a great question, and the answer is somewhat variable depending on the situation. If there were someone at a church service, likelihood would be that through the contact tracing process, we would be aware of everyone who attended that church service and what their level of risk might be, and that wouldn't require a public announcement or anything of that sort because it could all be handled within that setting. Something like a protest, let's say there's 1,000 people at a protest and somebody identifies that perhaps as a site, they would have some close contacts too, which we would begin to trace, but obviously they probably wouldn't know all 1,000 people there. So if we saw an uptick in cases that was temporally and by history related to such a protest, that might be an opportunity that we would do a public service announcement and a public health announcement to make others aware that we believe there was a point source of infection at that setting. That has not happened in Vermont at this point in time. And even around the country, we've had many, many nights and days of ongoing protesting. And every public health official is really very anxious about that, but at the same time, we're not seeing reports of very large outbreaks. So we'll have our fingers crossed. I am, again, very, very heartened by the fact that whether I look at it in Vermont or whether I watch television from another state, lots of people have facial coverings on during the times of these protests. The thing that's most difficult for them to adhere to is, of course, the physical distancing. But fortunately, they're all outside, which clearly helps. But we'll just have to see as the days goes by how that plays out. Thank you.
So does that mean that it would take multiple positive tests of people participating in one event, like a protest, before you would make a public announcement?
Everything we do is data-driven. So we would look at the data, and if we've been able to clearly look at a causality and an association between attendance to that event and cases, where we were quite confident and certain in that from the data, we would do just what I said. We wouldn't do it casually because we really do need to remain very much data-driven and not create undue anxiety amongst the entire population if we don't have our act together very closely. So we really have to know what we're talking about. But the data would lead us there.
All right, thank you. Appreciate answering that from Wednesday. What I really wanted to know
Greg.
for today's question, since
Greg.
I'm limited to one.
Greg,
Yes?
we'll come back to you if we have time at the end, but that was two
Well,
questions.
hold on. I was promised on Wednesday that I could ask the question on today and
So
be
you're
answered.
taking up the time.
No, that's right.
My
No,
question
I did
today-
say that. Go ahead, Greg.
What's that? Thank you, Governor. So my question today, we had a reader reach out to us, shared with us an experience at two area hospitals, and maybe the health secretary on health or somebody else can help with this. They brought their elderly mother to Northwest Medical Center. They weren't allowed in, even though their mother was experiencing stroke symptoms and couldn't speak for herself. So that elderly person ended up, being treated through the ER without being able to communicate. Later in the week, that same patient was admitted to UVM Medical Center and spent the better part of a week there, again, without being able to communicate and without having their support family members at the hospital to help. So at what point can the general public expect to be able to help their loved ones going through something like that? And if that's already being allowed at the state's level, but not at the hospital level, who should they be reaching out to if they feel like they're not being well taken care of?
I'm going to refer that to Commissioner Levine or Secretary Smith.
I issued the guidance.
Sure. We'll let the secretary answer. I can add.
Thanks, Craig, and I'll probably let Commissioner Levine add on. I issued guidance per the executive order early on in this pandemic that basically talked about the minimum levels of visitation at hospitals, none of which is described in how you have described it. They are allowed a family member as a one family member during visitation to accompany this patient. So have the person contact me, and I will reach out to both Northwestern and wherever, and UVM, I presume, and we'll make sure that we straighten this out.
Thank you, Secretary. I'll certainly give them your contact information.
Mike Donahue, the Islander.
Dr. Levine. Just a clarification, did I hear the governor say these new cases, this is all coming from one family?
No, I believe he said it was coming from a social network. So that implies more than one family.
Okay.
Doesn't mean it
Just,
isn't, doesn't mean it's not in a household, but it's not one family.
Sure. And my question is, are all these people actually in Winooski? And you sort of, the wording is a little vague that they're associated with Winooski or whatever. And what is your contract tracing actually showing as far as if some of those people have now gone to Grand Isle, Franklin, or other parts of Chittenden County or outside of Winooski? I mean, the colored map actually that you have, it doesn't even show the numbers in Winooski properly. It's colored as 25, but the list says 17. So I'm just wondering what your numbers actually show too.
Sure, I won't comment on how up to date the numbers are based on the fact that this is a rapidly evolving situation. But I can assure you that the cases are all within the city of Winooski. I can also further reassure you that there are no facilities such as schools or workplaces that have been identified as locations of known transmission of the virus.
All right. Kat, WCAX.
Thank you.
Hi. The timeline there will be allowed again without a 14-day quarantine. So is that likely this summer or not until a vaccine is in place? Asking in part for transplants who might have family in other states, but also looking at the health of our airports long term.
Yeah, I didn't get the first part of the question, Kat. Could you repeat that?
Sure. Any timeline for when air travel is going to be allowed without a 14-day quarantine requirement? Is that going to be like this summer or not until a vaccine is in place?
Yeah,
Like I said, asking for transplants like me, but also, the health of our airports, who are probably not having too many visitors come in at the moment on planes.
Yeah, again, this is going to be determined by the data and what we're seeing across the country as well. And it may be from different areas, different states and so forth. But, coming by air, traveling through a different terminal is going to be problematic. So it's going to be a bit of time before we're able to do that. We're hoping at some point to update our quarantine requirements so that it makes it a little bit easier. But I don't see that happening in the near future.
All right. Ed, Newport Daily Express.
Good morning. My question is, as daycare centers and summer camps and summer school summer programs opening, educators have an issue with wearing masks as they feel that hurts their communication with children. The alternative is shield. Can somebody tell us whether or not shields are actually better than wearing masks in terms of safety? And is this something that you would advocate?
Yeah, I'm going to let Dr. Levine answer that because I think I know the answer myself, but he can either qualify that or not. But I don't believe that the shields are a replacement for masks for a variety of different reasons. I think the masks are able to collect the droplets from around either nose or mouth, and whereas the shield would be able to emit those underneath the shield itself. So I don't believe it's a replacement.
Okay.
The governor said it completely correctly.
You don't get that every day.
All right.
All right, thank you. Brittany, Local 22. Oh, sorry. Sean, the Chester Telegraph.
Oh,
Sorry.
can you hear me?
Yeah, go ahead, Brittany, and then we'll go back to you, Sean. My apologies. Brittany, go ahead.
Okay.
Sorry. So just a quick question. So with the current outbreak in Winooski, does this concern you at all with opening up indoor dining in that specific area? And then kind of also going off of that, in the future, if we do see more outbreaks in certain areas, would you consider tightening the restrictions on that specific area?
Well, again, we are letting local control determine some of that while we've opened up interior dining, inside dining as of Monday. We have allowed for any community to take more restrictive steps if they don't feel it's safe in their community. And that's where we're working. The health department is working with the city of Winooski at this point in time to determine whether they'd like to continue moving forward with what we see as safe, but it could be determined by the community itself, as we did with masks.
Thank you so much.
All right, back to Sean, Chester Telegraph.
Thank you. The administration has been repeatedly said that its decisions are science-based and data-driven, but there's a lot of anecdotal evidence here in this area that many people are coming from states that have high infection numbers and do not quarantine. So I'm wondering, what empirical data does the administration have that shows that that's not the case, especially as you loosen up the travel, the leisure travel rules? Thank you.
Yeah, we don't, to be perfectly honest with you, we don't have that empirical data that you're referring to, because we don't have anybody at the border other than counting license plates and so forth, different colors from different states, but we don't know where they're going, whether they're going in or out. We can only do it anecdotally. We don't believe that it's widespread, but that doesn't mean it's not happening in your region, because it probably is. People with second homes and so forth coming for the weekend from some of those areas. So there's nothing perfect about the system that we have in place, but we can't shut down our borders and we can't screen people as they come in to determine that. So we have to live by the system that we have at this point in time.
All right. Chris Roy, Newport Daily Express.
Yes, good morning. I'm just wondering how people who are planning rallies for this weekend can practice social distancing, how that's going to be enforced. And what if the what if the people at the social distancing exceed the 25 maximum capacity? How is that going to be enforced?
Yeah, the reality is it's not being enforced. It's being encouraged. We hope that people, if they partake in that, to exercise their constitutional right, that they do so as safely as possible. Wear face coverings. Try not to mingle with any one group for any period of time, and try and distance yourself as best you can. but knowing that there's nothing we can do to enforce that measure.
Okay, thank you.
Ann Wallace Allen, VT Digger.
Hi, Governor. I hope you haven't already answered this. I hopped off the call to write something quickly. As you know, the state legislature and you guys are working on plans to distribute this $1.25 billion, and I'm wondering what you think of the House Speaker and Senate President's latest plan to expedite some money for businesses.
Well, if it includes the $400 million that we believe is necessary for economic recovery, I'm all for it.
Can you talk to me a little bit about that? Like, how do you feel about their idea that we shouldn't be cutting back on spending right now?
That we shouldn't be cutting back on spending. You mean in our state budget?
That's right.
I believe that's being short-sighted. I believe that we're all going to have to tighten our belts a bit. I know businesses are going to have to, each and every one of us individually are going to have to, and we as a state are going to have to as well. It isn't business as usual. It's not, these aren't normal times. We've seen a significant drop in revenue. We'll continue until we get the businesses open back up, until we get money in their hands so that they can continue to survive. We're not going to have the money from those sources to continue. So I don't see this getting better in the near future. So I would say the first thing we have to do is get the money in the hands of those who provide the jobs and provide the revenue. It's lifeblood for the state budget. As well, we're going to have to tighten our belt a bit and make sure that we're doing our part.
All right, thanks.
Thank you. Wilson, AP.
Good morning. I have a follow-up to Mike Donahue's question. I was asking a variation of it anyway. The governor's comment about the cases in Winooski being confined to one social network of families, in my mind, that doesn't quite square with what the commissioner and the officials in Winooski were saying this morning. I wasn't there, and so couldn't ask the questions, but that seemed to be more indicative that you were thinking that was sort of random Winooski residents. And one social network of families seems to, well, not be random. And I was wondering if you could explain the distinction there. Am I missing something?
Well, I'll let Commissioner Levine again determine what was said this morning. I wasn't there, but here's what I know. I believe that all these cases were socially integrated in some way. They may not be geographically situated in the same place, but socially they're all connected. I believe for the vast majority of them are. So that may be the confusion in this, but I still believe that most of them are connected socially in one way or another. Commissioner Levine?
And I think the governor said it correctly and appropriately. At the press conference this morning, I did not say what you just stated. My comments really weren't talking about community-wide spread of the virus. But at the same time, as we stated just a moment ago, it doesn't mean it's geographically in one particular place, even if it's within the city limits of Winooski.
Okay, thank you.
Maria, the Washington Post.
Good morning, everybody. Thanks so much for having this call. So I have questions about your data. So I understand that you're looking at various metrics, not just one. So it looks like nobody's hospitalized with COVID in Vermont. ER visits for COVID are down, and you've had no deaths in, it looks like approximately a week. Is that right?
Or more, right?
Or more, yeah. So I understand that, but I do have a question about your overall number of infections. Yesterday I spoke with a family in Guilford who said all 5 of them were sick, and there's at least one other person who got sick in that town, and yet there are 0 cases for that town in your map. And so I guess I wanted to know, is Vermont only reporting confirmed cases and not presumptive cases? And does that mean that your 1,000 cases could be 5,000? Is this an undercount?
I'll let either Commissioner Levine or Commissioner Pichek answer that.
So thank you for the question. We have been reporting confirmed cases all along, so those are folks with a confirmed COVID positive test.
Okay, so sorry. So just a quick follow-up to that. I apologize. So how high do you think your numbers could be? Because this family said they went to get a test and were only given one for the family and told to assume that the rest of them had it.
So I think I'll let Commissioner Levine answer that, but certainly, all along the way, there have been estimates about asymptomatic cases, and those estimates have moved over time, and we don't necessarily at any given point think they were necessarily reliable as indicative of how many cases we might have or any place might have in terms of asymptomatic or mild cases. So we've used the active cases as the best sort of proxy for understanding the disease prevalence, but I'll let Commissioner Levine talk about that specific example.
Yeah, thanks for raising the issue. I think the whole idea behind the presumptive category is to try to get a better handle on the real number. That's why the CDC started to talk in those terms, because every state knows they are vastly underestimating their COVID experience by looking at only test positive cases, knowing that there's probably greater than 25% of cases that are asymptomatic, that there were tons of cases in children that were never established because children weren't usually tested until later in the process, a whole host of reasons. The problem with the presumptive category, though, is that presumptive is only that you know it's presumptive, meaning somebody told you that they had a history compatible with COVID. And there are so many people who are sort of staying at home, feeling mild illness, and they're never going to call their doctor for that. They're not going to get connected to the healthcare system for that, and they may well have been a case. So I do understand where you're coming from. I don't want to just make this anecdotal, because I likewise have talked to individuals and occasionally families that felt that they probably had COVID, and they're reporting that back from March, before we even had testing available in the country. And I believe their stories, but there's no way to validate that they were true COVID cases. So I think the theme that we should convey to the population at large is that there is no state in this country and no country in this world that can accurately portray its experience with COVID, and that everywhere you go, there are underestimations, perhaps with the minor exception of South Korea, since they have tested so many in their population. But otherwise, we're all underestimating, and we just have to be frank about that, but at least use the data we have in a constructive and productive way, as we're trying to do here in Vermont.
Thank you. I just wanted to make sure that.
Oh, go ahead, Maria.
I just wanted to make sure that. Sorry. Since it's so data-driven and the data is so uncertain, I just wonder why you feel confident moving forward. Is it because of those other metrics you mentioned?
Why are you going forward?
Why are you confident because of the other metrics we're looking at? Hospitals.
Yeah, I mean, I still think we're comparing apples to apples, and whatever strengths as well as what other insufficiencies of our system we've had all along, we have on an ongoing basis, and we're comparing middle of March to early June in very similar ways. So I think that consistency is really, really important.
Okay. Thank you.
Let me just add about the testing, though, so that we're clear. While in the beginning we had a limited number of tests and we weren't able to test everyone who wanted a test, that is not the case today. So if you're anxious and think you may have COVID, come in and get a test. We want to make sure that we test everyone who wants one, whether it's at a protest and you're not feeling well and want to have a test, and just is in the back of your mind, have a test.
All right, Tim, Vermont Business Magazine.
Governor, just to follow up on Ann's question, there's a draft in the legislature that would basically break up the emergency fund in half and provide, and I think that the provide half right away, and what would happen to the other half is unclear at this point. I think that's what she's talking about. So what is your opinion on breaking it in half if that were to get the money out a little quicker than having to go through the ponderous legislative process?
Yeah, we want to get the money out as quick as possible. Whatever means that takes, will encourage that. So the quicker we can get the money in the hands of those who are in desperate straits right now, the better off we're going to be. So if it has to be split up in order to do that, I would just ask that they take the, if they do it in half, take the second half and continue to work on that so we can get the second half of the $400 million out the door as well. That's what it was intended for when they passed this in Congress, was to help make sure that we're able to keep these businesses sustained and to support them so that they don't go out of business, because we need them in the future, in the near future. So I'm just hopeful that they will, get as much money out the door as they can, but then follow up and continue to work on the second half of that.
Is that your understanding as well, so that's their idea right now?
I don't know what their idea is, but from my standpoint, I would like to see them pass the whole package as quickly as possible. But if that is not possible, and they can only get half done right now, immediately, then let's do that first, and then continue to work on the second half.
Yeah, that's the draft bill that I've seen right now, is to actually take the emergency fund and go from 150 to 70 right now, but there wasn't an idea of when actually the timeline was, so it sounds like you don't have an idea of what the timeline is either.
I don't, and again, I hope we continue to make sure that we have the 400 million figure in the hands of businesses and entities throughout the state, nonprofits alike. It's a complete package, individually, business-wise, nonprofits, and so forth, that continues to keep the lights on, so to speak, and helps in order for us to thrive in the future. So I think it's essential, and if they do take up the first half, then again, I don't want to save this money for anything else, because it's intended to get in the hands of all those who are struggling today.
And further, the idea was to get the whole package done by the end of June. Would that work for you?
That would work. I mean, if we can get half of it out immediately, and then the other half out by the end of June, that would be helpful.
All right, we've got to.
Great, thank you very much.
Yeah, we've got to go to Lisa, the Valley Reporter.
Hello. My question is about the reopening of restaurants for inside seating. In addition to the 25% inside seating, can restaurants still have up to 50 people seated outside with appropriate social distancing between tables?
Yes, it's in addition to, but I'll let Secretary Curley answer that.
Yes, thank you. The governor is correct. And if there's any question on it, again, the guidance is up already on our website. So I would be sure to take a look at that. We have consolidated the outdoor dining with the indoor dining so that it's clear what is permitted at this time.
Thank you very much.
Thank you. Going to Kurt Wright, WVMT.
Hi, Governor Scott. I want to ask you, we've had, obviously it's been mentioned that we've had protests, large protests in the state of Vermont, in Burlington, St. Johnsbury, St. Albans. There'll probably be some more. They've been very large, and some wearing masks, some not wearing masks. If people are tested and they're not large outbreaks of any kind as a result of these large gatherings, can we more rapidly start to change things like the 25-person gathering limit, and then potentially move to the lake monsters being able to reopen their season, bars being able to open? And has there even been any discussion within the administration about when or what it would take to actually lift the state emergency order?
Yeah, again, that's our goal, all the above, to continue to open up as quick as we possibly can so that we can get back to some sort of normal. We're doing it a little bit at a time. I think it's a big step we're taking today, again, to open up restaurants, and even in bars in some respects are going to be open. It's just that the bar itself, you can't seat at the bar. So if there's tables within a bar, it's the same type of approach. So we're moving in that direction, Kurt. We want to get there as quick as anyone else does, but we have to do it in a safe manner and just methodically doing it a bit at a time.
Okay. If I can just follow up, Governor.
Yeah.
I know that there were discussions with the Champlain Valley Fair. Have there been discussions with the Lake Monsters about if there'd be any possibility of their season beginning? They couldn't,
not,
obviously, with a 25-person limit.
I'm not aware, but I'll let Secretary Curley answer that.
Yeah, thank you. I can't confirm that we specifically had a conversation with the Lake Monsters, but there is an entire team that is currently working at what events might look like as we continue through the summer. So we're hoping to have more information on that in the very near future, as I just want to assure you that it's being looked at and we're thinking about it and trying to get creative while keeping people safe.
Thank you.
Avery, WCAX.
Governor Scott, I don't know if you were able to listen to the press conference, the Winooski press conference, but some community members came forward and kind of expressed some concern about resources for immigrants and minority populations. And I was wondering if the state has resources or a plan to help those people with all the health guidelines and things that have been going on.
I did not get an opportunity to listen to the press conference this morning, but we do have a number of programs available to help that population, and I don't know if Secretary Smith might be able to answer that, or Commissioner Levine, one of the two, or both.
I didn't hear the press conference. I didn't hear the specific concerns, but if there are concerns in terms of material, in terms of translated material, if we aren't getting enough information to those communities, we will get the information that they need to those communities. There is, the health department in particular has done a very good job in communicating with the various new American populations and other populations in Winooski throughout, whether it's pre-COVID or post-COVID, or it's whenever we have had any sort of health communications that we have to do. So we're going to make sure, if I'm hearing you correctly, if there is a concern, we will address those concerns. That's on sort of the communications aspect. On the need aspect, we work closely with these communities to make sure that there are sufficient means to get through, whether you're isolated or any other person in the state of Vermont, as we have done throughout this COVID crisis, to make sure that we step up and make sure that they are surrounded with services that they may need. So if we haven't communicated, we will in a better way. And if we need to provide more services, wraparound services, to assist Winooski in this, we will as well.
Can you just explain briefly what kind of outreach has been done starting when the pandemic began?
Hi, this is Dr. Levine. First, I want to just very publicly thank the members of those communities that actually were at the press conference this morning, because they added a whole new lived experience dimension to the conference that we wouldn't have otherwise had. And I believe, if I interpreted their questions correctly, and I think I did, most of them were not really discussing what has been going on the ground right now and into the future. It was really pre this outbreak, and it was really framed in a prevention mode. I want to reiterate what I said during my prepared comments, that the work of public health is not public health just coming in and taking over and doing it all. We would never succeed that way. We always rely on tremendous partnerships and collaborations. And that's what this work in Winooski has been all about since the moment we learned about the first case. However, a few members of diverse communities who were present at the press conference did imply that their populations did not understand some of the concepts that we've been preaching, if you will, about how to avoid the spread of COVID, how to be in a preventive mode. And we needed to listen to that and really understand that if there were certain languages our materials weren't translated into, and certain populations that we weren't reaching, even if we had the right materials, this is an important learning experience, and we will move forward with it. But I do want to reiterate, it's been only tremendous collaboration and partnering that has gotten us to the point we're at now, and all of the uniform compliance with some of these directives about isolating and quarantining that members of Winooski have had to go through. Everyone's on board, and everyone's been really working well together. Thanks for the question.
Thank you.
Eric, Times Argus. Eric, Times Argus. *6 to unmute. All right, we'll go to Aaron, VT Digger.
My question is about the, determination of the step one counties. When it comes to the cases, we do have county level data, but I haven't seen any county level data on the number of tests being performed or the positivity rate of an area. I do know that statewide, Massachusetts, New Hampshire, and New York all have positivity rates that would not meet the Vermont criteria as a whole. How certain are we that the low case numbers in the counties we're looking at aren't just due to under-testing in those communities?
Mr. Pichek.
So Aaron, that was a good question, and in Vermont we're looking at all of those things: serdromic surveillance, case growth, positive tests, and hospital capacity. We're not as concerned with hospital capacity, obviously, in the other states, and we thought a good proxy for those other three are really active cases. What are the active threat at a given point? But of course, built into that is the assumption that there is widespread testing. We have the testing data at the statewide level. We know that New Hampshire and Maine, I believe, have both moved to universal testing, similar to Vermont, and that similarly New York has testing built into their regional approach for reopening. So the places where we have had large, where basically most of the reopening is happening, we do have confidence that there is widespread testing available. Of course, as you point out, statewide, those percent positives wouldn't meet our threshold, but on a more limited basis, we're reasonably confident that they would on a county-by-county approach based on this active case count.
Okay, thank you.
Joe, Barton Chronicle. Joe, the Barton Chronicle.
Hello, I'm not entirely sure who this question would be best for, but I understand you're saying that the figures that we have in the state for the number of cases are at least internally consistent. Do you think that measurements in all states are more or less statistically in line with the measurements that we've taken in Vermont? And is there any consideration being given once there is a sufficiently reliable serology test to doing widespread testing with the idea of seeing how many cases might have been missed through non-reporting?
I'll let Commissioner Levine answer first.
Perhaps if Dr. Kelso's on the phone, I'll have her as the state epidemiologist ask your data question. Dr. Kelso, do you need him to repeat it?
No, I think I got it. Thank you for that. The data that we're using to inform the county level reopening is based on data that all states report nationally, and the Johns Hopkins University is summarizing that data, and then we're basing our calculations on that. So we feel that it's standardized, collected in a systematic and standardized way.
And is there some thought being given to when things calm down and there's a sufficiently reliable serology test, doing widespread antibody testing to see if there is a consistent level of non-reported cases that you can pick up?
I could answer that if you'd like. We're spending a lot of time discussing that right now, and we'll certainly have some answers for you in the future. We know that doing an assessment of the population at large, like you're talking about, would be a very mammoth, extraordinary task, so it would most likely be a sampling of the population. And you framed everything just right. It has to be the right test. In a state that has a very low prevalence of disease, you need a very highly specific test, so you know that the positives are true positives and not false positives. And you need to decide how that information is going to help you moving from this day forward. So we really want to be very deliberate about that. There's certainly no urgency to doing statewide seroprevalence studies, as they're called now. Our focus really now is on active disease and on finding out if somebody has symptoms or even no symptoms if they have active virus. So the questions that the serology studies would answer are very different, and we want to plan accordingly for those.
Thank you very much.
All right, Steve, NEKTV.
Can you hear me?
Yes.
Governor, regarding the license plate data, is this data being gathered by machines or by people on 3 different ships at every point of entry?
Yeah, we're not doing it 24/7 at this point in time, so it's on a much more limited basis, but it is done. Some of it's being done mechanically in some of the lower volume areas, but and just to get the traffic counts themselves. But the vast majority is done by people just looking and taking the information down. Just the again, where they're from, what state they're from, not their individual numbers.
So some of it's being done mechanically?
Just in the lower volume areas, there's a mechanical count, just so that we know about the volume of cars going back and forth.
I checked the websites for the mechanical plate readers, and they seem to gather all data, the numbers, even the counties in some instances. They can even read like the up-to-date registration stickers and stuff.
Yeah, no, we're not using any of that. I'm talking about when I'm talking about a mechanical counter, I'm talking about the rubber strips across the road to determine volume of vehicles, not any specifics. It doesn't read anything.
So you're not gathering the plate data by state?
Not in those low volume areas. There's a few, we have a number of points of entry into the state, some that you probably have never seen before, and I certainly haven't seen them all, but they're just very, very low volume areas, and we just didn't think it was a good use of our time to monitor those physically.
So some are mechanically then?
Yeah, low volume areas.
I see. And that data, will that data be dumped at some point?
Dumped? You mean, it's in what?
Well, I mean, if the machines are gathering all the data about the numbers and who specifically the vehicle's registered to.
We don't have any of that data, Steve. I don't know how much more clear I can be. We are not determining the license plates themselves, who owns the vehicles, who's in the vehicles. None of that is being recorded anywhere. All we're doing is determining what state they're from.
I see. Okay, I guess we only get one question now, right?
You had 4, Steve. I think you should be fine.
That was the same topic. Thank you very much.
All right, Guy.
Thank you, Governor.
Guy Page.
Hello, Governor. My one question, and first, thank you for this press availability and for all of your hard work. You said earlier that the ralliers this weekend are being encouraged to socially distance, but will not be required to do so due to their constitutional rights. Can you please explain why our constitutional right to protest is allowed to continue during the state of emergency, but assembly to express our constitutional freedom of religion has not been permitted until recently? To some, it seems like a double standard where the squeaky wheel gets the grease.
Yeah, Guy, if we could enforce the situation in some manner, we would rather people socially distance themselves or physically separate themselves. But the fact of the matter is we can't. We just can't. So we have to play the cards we're dealt, and hopefully people will do so safely. Will wear facial coverings. Will not congregate in one area amongst more than 25 people in one area. Will separate themselves in any way they can. So just we're asking people to use some common sense, and but we don't want to preclude anyone from exercising their constitutional right. And so again, we're trying to do all we can to keep people safe, but recognizing this is a time of grief, anxiety, frustration, and we want to make sure that people are able to at least verbalize that and show that.
Thank you.
Kevin, 7 days.
Can you hear me, Governor?
I can.
Thanks. My question involves the relaxation of the quarantine restriction and the allowing folks from low-risk counties to come to the state again. How is the state or our businesses going to determine whether people have come from such low-risk counties? And is it essentially going to be an honor system on the part of the visitors to not come if they are from a higher risk county? And then the corollary to that is, how did we determine 400 patients or 400 cases per million as a safe threshold?
I'll let Secretary Curley answer part of that, and then Commissioner Pichak the other half.
Yes, thank you for the question. Opening up the counties around our state and inviting folks here is going to require a little bit of trust and a lot of education and some effort on the part of the lodging industry. When somebody makes a reservation to come here and stay in one of our lodging properties, they will have to certify that they have either met quarantine requirements that are in place at this time, or that they are coming from one of the counties that is listed. Our map will be updated every Monday. Again, I know this is not a perfect system. It takes some effort on the part of the lodging owners to keep an eye on who's coming in. But, we do trust that the lodging owners don't want an outbreak any more than anybody does. And so I really do believe that part of this is trust. There is a certification, and we will continue to provide education to make sure that folks can comply with this. As far as the 400, I will pass that over to Commissioner Pichak.
Thank you.
Yeah, thanks for that question. So the 400 was arrived at, again, we wanted to find a simple metric that told a number of different things in one data point. We think active cases does that. In terms of the 400 threshold, we really looked at what Vermont counties are experiencing, and typically they're anywhere between 0 cases per million to 206 or so cases per million. So that's sort of the range, and we've been generally in that range from 0 to 200 over the last few weeks. So considering, that many other areas are experiencing a much higher number of cases in the 3,000s in places around Boston or New York or Connecticut, 400 was a relatively safe number in terms of the low transmissibility. It looked similar to Vermont's disease prevalence. And then, I think there's always an element of risk when you take a measure, any measure, but this one is a relatively low level risk, considering the cases that are around us. And we are also asking, of course, visitors to register with Sarah Alert with the Department of Health. That would help keep track of if they develop symptoms, whether they're here or when they return to their home state.
Thank you very much.
Okay, we have some time left to circle back to folks who have let us know they had other questions, and that will start with Kat from WCAX.
Hey, so hearing from some lodging establishments that they're not seeing a lot of interest in, visiting Vermont from people in some of those counties that are currently, as of Monday, going to be allowed to come and book and stay with us. Is there a concern that we're just going to see places not open up because it's not financially feasible?
Well, I think, considering what they were facing before with a 14-day quarantine, they may not have had any interest in coming to Vermont. But having the opportunity to come to Vermont without a 14-day quarantine may encourage them to take a vacation to come visit Vermont through other regions. And we're talking about a number of people in these safe counties that could. So we'll gauge that. I don't have the answer to that. I don't think we'll know that until we're maybe 2 or 3 weeks in. But I'm hopeful that this will allow for more mobility and more travel, more people again to come in to visit our beautiful state.
Thank you.
All right, we're going to try Eric at the Times Argus again.
Can you hear me now?
Ken.
My question is about the homeless population. Is there any plans for how to handle them going forward? Are they still going to be in motels and hotels? And is there any timeline for when shelters might be able to reopen?
Yeah, that's a concern for us. Secretary Smith, I'll ask you answer that.
Your question is timely because yesterday we met as a group to try to figure out what we're going to do. As I have said before at these press conferences, the situation that we have now, where we have over 1,000 people in motels, hotels, is not sustainable, and it is not the preferable way of dealing with homelessness. So we will be presenting a plan in the next week or so to the legislature as soon as I preview it with the governor and make sure that he's comfortable with it. But on its way, there is a plan in place to figure out, A, how do we deal with this transition? Because many of you may not know, during the COVID crisis, we moved a lot of the homeless into the motel-hotel program. That, and like I said, that's not sustainable because A, it costs a lot of money, and B, there's no services that surround the individuals within that program. And we really need to surround people for permanent housing, for at least midterm housing, and also bring back online the shelter system that was closed down. As you alluded to, the reason we had to move people into motels is because the shelter systems had to shut down during this crisis. So stay tuned is the bottom line.
Thank you.
Joel, the Burlington Free Press.
Anyone there?
We are.
Oh, great, thanks. I'm asking a question about dining on behalf of the smaller restaurants and pubs who probably can't afford a financial advisor or a lawyer or it's on retainer. So is there, aside from the relaxing of the restrictions on sit-down dining and sit-down pubbing, what kind of assurances can the state offer or announce that help is on the way in other ways, financially, presumably, is highest on their mind?
Well, again, we've put forth a $410 million package that we believe that can help. There is a webinar this afternoon that I had announced at 2 o'clock. ACCD is going to put that on, so accd.vermont.gov. If you can take a look there, it might be able to answer some of your questions. But between the PPP, as well as allowing for a longer period of time for that program, that Congress, it appears they've passed, the President will sign, will be very helpful, as well as some of the programs we have in place within that $410 million package that we presented to the legislature would be very helpful as well. So between the two, again, it's not going to be enough, but it's a good start. Secretary Curley, anything you want to add to that?
Yeah, the governor hit it. I just want to highlight, as a former small business owner myself, I want to make sure that those small business owners who don't have, as you mentioned, accountants and lawyers on retainer, we want to be helpful to you. We want to make sure that you're provided with the support that you need to navigate the different relief packages. So I highly encourage you to reach out to our agency. If you don't have time to do the webinar today, definitely send us an email and let us know that you just like some information, and we are really, really desiring to work with you. So just trying to reemphasize that small businesses we know need a little more technical assistance, and we're here for you.
All righty. Well, thank you very much, and it looks like you're going to meet your deadline, 1:45.
We're not done yet, Joel.
I was going to ask the porta potty industry too, but we'll some of the
Next week, Joel.
Governor, you share your thoughts on the situation in St. Johnsbury. It looks like during a protest there was an incident between police and some protesters. Have you seen any of the videos shared around that, and could you comment on that situation?
Yeah, I did. I did see the video. Unfortunate situation. We want people to be able to exercise their rights and do it in a safe manner, and to accommodate for that as well. Unfortunately, it took the turn it did. I know they have an independent review of that coming up, and I know the Attorney General is taking a look broadly. We put out a joint statement on this yesterday. So we want to make sure that, again, this country was founded on exercising that right, having our voices heard, and we want to continue that. It's part of, the fabric of America. So, but we want to do it in a safe manner.
All right. Greg, the county courier, had another question. Greg? All right. If Greg's not there, I guess we're all wrapped up in time. A few minutes to spare.
Great. Thank you very much. Have a very safe weekend, and we'll see you on Monday.